Now, I want to look at a particular terminology, and this is what is known as a superficial wound sepsis. Superficial wound sepsis. So, just a wound up, but the infections they are now tracking into blood. Okay. So superficial wound sepsis just have to do with infection of the skin and the subcutaneous tissue at the site of a wound. Do you understand? Yes, there's a wound on top, but it actually got infected. Okay. So it's a localized form of sepsis and it's confined to the superficial layers without the deep layers being involved. Of course, if you leave it, it will now progress to the deep layers, okay, causing much more issues. So examples, bacterial contamination of wounds like all the Staphylococcus aureus, Streptococcus pyogenes, okay, all those gram-negative bacteria and all of that. So what could actually make a superficial wound to get infected include things like poor wound hygiene, contaminated injuries, foreign bodies in the injuries, soils in the injuries, diabetes, malnutrition, immunosuppression. So anything that is weakening your immune system can now predispose you to things that you should have resisted. Then also prolonged use of dressings and tight bandages. Okay. So clinical features, you see all those redness of the wound, swellings, and the area is hot. Okay. Pain or tenderness, purulent discharge of pus, and there's delayed wound healing. Okay. Sometimes the infection can now track into the body system, causing fever and malaise, and also lymphangitis, then lymphadenitis too. So diagnosis, all those clinical examination, very important. Wound swab or culture, blood tests, okay. Proper wound cleaning and debridement of any tissues that have died and there's no hope of resurrection. There are regular dressings with antiseptic solutions. So use all those antibiotics, which will be topical or systemic, just to drive away the bacteria, and keep on with good nutrition, good glycemic control, because in diabetics that's what usually leads to all those wounds and all of that. Okay, so that's what we got.